Hello, and thank you for taking the time to learn about spinal cord stimulation. My name is Dr. Jeff Wasserman with Lake Orthopedics and Sports Medicine, with offices located throughout the Dallas, Texas area. I want to provide you with a simple explanation of this treatment and how it might help with chronic pain. Spinal cord stimulation is a medical procedure that uses a small device to send electrical pulses to spinal cord nerves. These pulses block pain signals before they reach the brain, offering relief for conditions such as chronic back, arm, leg, or nerve pain anywhere in the body. In this video, we'll discuss the medical indications for the procedure, how the device works, and what you can expect if you decide this treatment might be right for you. Let's discuss when spinal cord stimulation might be a good option for managing your chronic pain. Spinal cord stimulation is typically considered for the following conditions. If you've been dealing with ongoing pain in your neck, back, or legs, especially from conditions like cervical spine nerve damage, sciatica, spinal stenosis, or spine degenerative arthritis, spinal cord stimulation may offer relief when other more conservative treatments have not worked. If you experience burning, tingling, or sharp pain in your limbs, often caused by nerve damage or conditions including sciatica, diabetic neuropathy, or complex regional pain syndrome, spinal cord stimulation can help manage these symptoms by interfering with the pain signals being transmitted up to your spinal cord and brain. Or if you've had neck or back surgery, but your pain has returned or hasn't improved, a condition called failed back surgery syndrome, spinal cord stimulation can sometimes help manage persistent pain that surgery didn't resolve or has recurred. In general, spinal cord stimulation is for people with chronic severe pain, especially when other treatments haven't been successful. It's not a cure, but it can help control pain and improve your quality of life. Let me explain how spinal cord stimulation works in simple terms. Your spinal cord is like a highway for pain signals. When you have chronic pain, these signals travel up your spinal cord to your brain, where you sense the pain. Spinal cord stimulation aims to block or change these pain signals so you feel less pain or none at all. The treatment uses a small device called a spinal cord stimulator generator, usually implanted 1 to 2 inches under the skin of the upper buttocks, and electrical leads that are easily placed through a needle into the spinal canal, behind the spinal cord, and the membranes that protect it. These flexible leads contain 4 to 16 tiny electrodes on the end. These electrodes are placed near the nerves in your spinal cord where the pain signals are traveling as electrical signal up to your brain. The programmable spinal cord stimulator generator sends out gentle electrical impulses through the electrodes. These impulses interfere with the pain signals, so instead of feeling pain, you may feel a mild tingling sensation often described as buzzing or massage-like. In some cases, depending upon the system utilized, no sensation at all may be felt. The goal is to mask the pain or reduce its intensity significantly. This process is called neuromodulation. The device is carefully programmed to target the specific area where you feel pain. It doesn't fix the underlying cause of the pain, but it can make the pain much more manageable, improving your quality of life. It can also improve blood flow to the body area supplied by these modulated nerves, so it has been used for this specific purpose in patients with peripheral vascular disease and even coronary artery disease. Dorsal root ganglion stimulation is similar to spinal cord stimulation in that the device used electrical impulses over nerves to inhibit pain signal transmission. The major difference between this technique and SCS is that the leads are placed over a portion of spinal nerves called the dorsal root ganglion, as opposed to being placed directly over the spinal cord. Although not used as frequently as spinal cord stimulation, since it is technically more difficult and leads are more likely to move over time, DRG stimulation can be used for lower back pain as well as other neurologic disorders such as neuropathy, damage to individual nerves called neuralgia, and also complex regional pain syndrome. Before proceeding to a full implant, mental health clearance is obtained for insurance requirements and a trial procedure performed to confirm if the therapy works for the patient. Temporary leads and electrodes are placed through needles into the epidural space of the spine in the back of the spinal canal. No incisions are necessary. These leads are connected to an external generator taped to the skin, and the skin site where the leads enter is covered with surgical dressing. The patient will test this system for about a week to see if it reduces your pain significantly. The trial also confirms exactly what spinal level the leads and electrodes should be placed. If the trial is successful and the patient has substantial pain relief and less physical impairment, we'll move to the next step a few weeks later, which is implantation. Roughly 60 to 70% of my patients will have a successful trial and proceed to implantation. This is an outpatient procedure done with sedation and anesthesia personnel. First, we'll make a small incision in your back and place the leads through needles permanently into the epidural space near your spinal cord. The leads are connected to muscle fascia with tiny anchors that prevent the leads from migrating inside the spinal canal, since their location needs to be very precise for long-term success. Next, we'll create a small pocket under the skin, usually in the lower back or buttock area, where the stimulator device, about the size of a small pacemaker, will be implanted. The leads will be connected to this stimulator and will close the wounds with stitches. The patient usually goes home within 1 to 2 hours of the procedure after the device is programmed in the recovery room. Although some discomfort at the insertion sites are not uncommon after spinal cord stimulator trials or implants for limited periods of time, any significant complication is very rare. If you have any concerns, please do not hesitate to discuss these with Dr. Wasserman or his staff. If you are having sedation, you will have the opportunity to discuss anesthesia details with your provider shortly before your procedure. Dr. Wasserman is a board-certified anesthesiologist and can answer most of these questions for you as well. Preoperative instructions. Please have nothing to eat or drink after midnight before procedure. You may take blood pressure and pain medications with sip of water in the morning of prior leaving for the surgical facility. It is very important that you discuss blood thinner use, including anti-inflammatory medications, with me or my clinical staff, since these medications need to be discontinued before the procedure and each medication has unique directions for this. Avoid use of GLP-1 inhibitors like Ozempic for at least 1 week prior to procedure due to delayed gastric emptying and anesthesia issues. Shower the morning of the procedure and scrub back with Hibiclens body wash or soap to more fully disinfect the skin. Postoperative instructions. Preoperative pain medications can be used as usual, but hopefully will be reduced over a few weeks after implantation as pain relief kicks in. Use antibiotics as prescribed. This are given during the trial as leads are sticking out through the skin, and we want to reduce the risk of any infection. They are given for a few days after an implant. After trial leads are placed, you may not shower during the trial, but sponge bathing and hair washing are permitted. Just avoid getting the lower back wet, or else the dressing keeping the leads sterile and in position may fall off. Do not exercise during the trial other than walking and light housework work. After a permanent implant, you may shower immediately unless told otherwise, since the dressing is water resistant, but avoid standing water, spa, swimming, for at least 4 weeks. Also, after implantation, gradually increase activity over 2 weeks. Avoid vigorous activity for 2 months to prevent early lead migration. The leads should be somewhat kept in place by scar tissue after 6. 8 weeks, making unwanted lead movement unlikely. I hope you found this video helpful. Spinal cord stimulation, SCS, offers hope to people living with chronic pain, especially when other treatments haven't provided relief. This therapy works by delivering gentle electrical pulses to the spinal cord, which can help interrupt pain signals before they reach your brain. For many, it feels like a calming or soothing sensation replacing the pain. What's exciting about SCS is how it's tailored specifically for you. Before the device is fully implanted, you get to test drive it with a temporary system to see how much relief it provides. Many people report significant improvement in their pain and find they can return to activities they once enjoyed. Advancements in technology have made these systems smaller, more effective, and easier to adjust, meaning we can fine-tune the treatment to suit your unique needs. For many, SCS offers not just relief, but a chance to regain independence and quality of life. While it's not a cure, it's a powerful tool in our fight against chronic pain, and for the right candidate, it can be life-changing. It's a step toward giving you back the life you deserve. If you have any questions or desire a consultation to discuss spinal cord stimulation, please do not hesitate to contact us by email or phone. Thanks you.